Facial symmetry and skin clarity are two of the most important factors among kindness and intelligence which make someone attractive. Facial symmetry has been shown to have a correlation with poor childhood health among British people. It also seems to reflect social status more than early childhood illness. Those with better facial symmetry seem to have a correlation with having a higher social class. So the poor of the UK are ugly. This is not exactly a secret. I have YouTube. I also have a guilty pleasure. I like to watch those TV shows on Netflix with barely intelligible northern Brits. They have smoking toddlers that are also obese and they go around in moldy caravans. But it's interesting because the poor of Latin America don't have any correlation with facial asymmetry. So social class plays a role among British people, but not among Latin Americans. Maybe being poor in South America doesn't limit your access to fruit and vegetables in the same way that it may in the UK. And perhaps they just have fewer deep-fried candy bars and better weather. It's hard to say because it's so multifaceted. Another study I looked at, trying to get deeper into this question, suggests that kids who are more physically symmetrical tend to have greater longevity as adults and improve reaction time. It's also been suggested that it may be related to neural development. So as your nerves are developing, it tells your face maybe to grow in one way or the other. And it's been suggested that this could be associated with certain mental disorders. The neurodevelopmental model of schizophrenia proposes that both genetic and environmental factors contribute to structural and brain changes in the intrauterine and perinatal periods, as well as in childhood and early adolescence. They use skull measurements in this study, and I have to admit, this signals my personal biases about phrenology and these other old-timey sciences, which are now considered to be completely invalid. Their use by the Nazis in World War II gives me a particularly creepy feeling around it, and I think most of us in the Western world share this aversion to skull measurements and looking at people's face and head shapes as a way to determine what may be right or wrong with them. Then, as I recognize this bias and relax past this bias, I have to admit that I can see changes in the face more dramatically with fetal alcohol syndrome and Down syndrome. Could there be more that the face is telling us that we just haven't been looking at since World War II because it's been so negatively associated with Nazis and phrenology and eugenics? We know that genetics certainly plays a role, but even when it comes to those thought to be beautiful, creative, and strong, there are conditions which will make their face asymmetrical. If we look at actress Angelina Jolie, beat poet Allen Ginsberg, and Icelandic strongman Hafþór Bjornsson, they all have something in common. All three have had Bell's palsy. Now, this condition is devastating to those who get it, and I'm also wondering if the etiology and pathology of this disease can teach us something about how the facial symmetry itself can reflect our inner health. By looking at a severe case of facial asymmetry and its treatment process, we may be able to unlock a secret to making us all look just a little bit more attractive. Bell's palsy is associated with disordered movement of the muscles that control facial expressions, such as smiling, squinting, blinking, or even closing the eyelid. There's a loss of sensation in the face. People get chronic headaches, they have tearing, drooling, and a loss of sense of taste on the front 2/3 of the tongue. They tend to get hypersensitivity to sound in the affected ear, and they often have the inability to close the eye on the affected side of the face. According to Columbia University Department of Neurology, College of Physicians and Surgeons, it can strike anyone at any age, but it occurs most frequently in pregnant women and people who have diabetes, influenza, a cold, or an upper respiratory tract ailment. According to the National Institute of Neurological Disorders and Strokes, this nerve disorder affects about 40,000 U.S. adults and children each year. Bell's palsy strikes men and women equally. It's less common before age 15 or after age 60. Why is this? I couldn't tell you. It seems pretty odd, really, because generally children and the elderly are more susceptible to pathogenic diseases. Bell's palsy is not considered permanent, but in rare cases it does not disappear. Currently, there is no known cure for Bell's palsy. However, recovery usually begins 2 weeks to 6 weeks from the onset of the symptoms. A majority of people with Bell's palsy recover full facial strength and expression. To get some answers, I decided to ask Stacey Ma, a third-generation acupuncturist who specializes in Bell's palsy.
The damage or trauma can come from a number of different sources. So the Western conventional medicine believes that it is a viral or bacterial infection. When the seventh cranial nerve gets inflamed, the nerve swells up and it has to actually pass through this tiny bony canal called the stylomastoid foramen. When the nerve is swelled, the transmission of signals to the areas where it's supposed to innervate, like the face and the neck, that transmission gets blocked. The third cranial nerve is responsible for opening the eye, and that's not affected. Only the seventh cranial nerve, so you cannot close the eye. So part of our treatment with Bell's palsy with acupuncture is that we will go directly to the muscle or points around it to stimulate and call for attention, the blood supply to the affected area to help regenerate some of the lost circulation in the nerve path.
What are the social implications for people experiencing this?
Many social implications, and it's not just social implications, it's your self-esteem. Again, it's your facade, so everything in your life would be different. You're going to feel anxious and pretty much depressed. After the anxiety, after the anxious stage, when you realize that, nothing else is going to help. So typically patients, if you don't seek the proper treatments or get early treatments, then, for example, after 6 months, usually the damage, the nerve damage from 6 months to a year, if you come to us after that, then it's irreversible. It's permanent nerve damage. You're going to have more symptoms than just the regular Bell's palsy, because by then your nerve basically degenerated. There's a lack of circulation in the area, so the muscle is going to atrophy. Your face is probably going to droop more. Your eyes just going to hang there. Yes, you're going to have eye infection. The eye is going to be chronically dry. You're going to have problem with your tear ducts. Lots and lots of problems.
Is there anything we can learn from autopsies about Bell's palsy and how it's affecting the body?
Autopsy of patients with Bell's palsy has shown elevated HSV1 in the genicular ganglia, which is connected to the seventh cranial nerve. So something like 80% of the patients in autopsy showed this elevation, but not in the controls. So that's when acyclovir, the antiviral, was invented, and this acyclovir antiviral specific target HSV1 and HSV2. However, the benefits of this drug has been very debatable. Studies have shown that when you're taking it versus when you're taking it with prednisone, that it works and it might not work. So actually a lot of doctors don't prescribe this anymore. And if you go to NIH, their website, it's the NIH Institute of Neurological Disorder, they actually don't list antiviral as a form of treatment, just the prednisone. It does list acupuncture on there as a form of treatment.
Is acupuncture the main modality that you use, or are there other therapies that you bring in as far as supporting the patient?
At our center is very unique because we offer various modalities. So we do acupuncture, herbs, acupressure. As you know, Bell's palsy is a paralysis, weakening of the face. So you definitely want to use some acupressure, twin-arm massages to get your circulation going. In fact, every patient who comes to our door, we, depending on how their symptoms and patterns present to us and what stage they're on, we give them acupressure. We also offer gua sha and cupping. We just have various techniques passed down from generation to generation, and our success rate is high. We also give patients at home kind of like a homework or home play. So facial exercises, herbal remedies. Sometimes we give out tools like gua sha tools for the patient to do some self-care at home.
In looking at the literature, it seems that acupuncture has indeed been found effective for Bell's palsy. Interestingly, there's a role of nitric oxide in the onset of facial nerve palsy, specifically by the HSV1 infection. So this also answers a question that I had. Why does Bell's palsy not affect the very young and the very old? Since pathogenic diseases tend to affect these folks more prevalently. Well, it's not just the infection, but it's the immune response. So it looks like the immune response is actually too active, and there's so much inflammation that it's cooking the nerve. This would be why people who are very old and very young don't have the power behind that immune response. So it's really those people between 15 and I think it was 65 that have that nitric oxide response, that inflammatory response that unfortunately can cause oxidative damage to that nerve. There have been studies with herbal injection therapy for Bell's palsy. They use specifically herbs like xixin and shichangpu. And this is called pharmapuncture. So it's using drugs that are punctured along acupuncture points. It's something that's been, interestingly, among herbs which kill the herpes simplex virus, there are 472 of the commonly used herbs which affect this. Generally, your bitter yellow herbs are the ones that affect it most easily for the acute stages. So those tend to have berberine. Herbs like xiaogucao, Prunella vulgaris have been shown to help with Bell's palsy onset. So does this mean that we should not make out with strangers on public transit? And if so, how else are we supposed to pass the time? Well, you can definitely make out with strangers on public transit, provided that you're under age 15 or over age 65, because then you're still relatively safe from Bell's palsy, because your immune system just isn't going to kick up enough to have that inflammatory response. As far as microcirculation, herbal formulas such as Buyang Huangwu increase the survival rate of the spinal motor neurons and spinal ganglia sensory neurons after peripheral nerve injuries. And this is thought to be by increasing the microcirculation and because of its antioxidant effect. So it reduces the death of motor neurons and sensory neurons after a nerve injury. So in this case, the nerve injury is happening because of the inflammation associated with the herpes simplex virus. And this has also been shown, this formula, Buyang Huangwu, can help to prevent the atrophy of the dominant muscle and promote recovery of. So generally speaking, at the early onset, we want an antiviral. Not just an antiviral, but a formula that will also have anti-inflammatory capacity. Then over time, you want something that will increase the microcirculation. And by regulating nitric oxide, acupuncture has the effect of reducing the local nitric oxide, venting off some of that inflammation. And in the long run, acupuncture is helping with the microcirculation. Now, is my acupuncture the only thing that will do this? Absolutely not. As Stacey Ma mentioned, they use gua sha, facial massage, some other therapies that will reduce inflammation in the short run and increase microcirculation to help preserve and protect that nerve function. So what can this teach us about facial symmetry? Well, first of all, we want to avoid making out with strangers if we have a strong immune response. And generally, we want to keep our inflammation in check. So depression, adverse childhood incidences, these can all increase systemic inflammation. Having a poor diet, that can increase systemic inflammation. We want to keep our inflammatory levels at a sweet spot. Now, if for some reason there is nerve damage, we want to immediately reduce inflammation and increase the microcirculation. That microcirculation is really interesting because you see someone's face, they're stressed out, it looks a little bit blotchy. And I think of people I tend to think of as being ugly. They have a look on them that they're kind of sick. And oftentimes, what I'm seeing is the blotchiness caused by an irregularity in this microcirculation, which may have associations with the inflammatory system. So if somebody's very angry or they're impassioned or they're getting a fever, you see different changes in the facial coloring, which can tell you something about the role of inflammation in their face and their body perhaps as a whole, and how that affects the microcirculation of the body. So if it's flushing nice and evenly, or if it's blotchy, if it's blotchier, perhaps there's a deregulation of the intracellular communication or distribution of nitric oxide. So it's getting bunched up in one area and it's deficient in another. And this is where you get the blotchiness that really makes people look ugly. People use a lot of makeup to try to provide an even blushing or even facial coloring throughout. And this is perhaps because at the root of it, they really need a more even distribution of those inflammatory compounds, which at the right levels are very, very good for us, and at the wrong levels are associated with various illnesses. And because none of us want to contract an illness, we have a natural aversion to those of us who are going through sickness or just have, as a long-term consequence of long-term inflammation, a kind of blotchiness and asymmetry to the skin. If the facial nerve is being affected differently, then this may contribute to facial asymmetry as well. So what to do at home? Make sure that your diet is clean, massage your face in the morning, and relax. Those would be the 3 take-homes from this. An exercise that's really common to do in China is to wake up and massage your face 100 times before you get going in the morning. And this is just to increase the vasodilation, the circulation in the face, because the better your circulation is, the better those nerves are going to be, the healthier that nerve tissue is going to be. Sometimes this is done with breath holding if you want to increase nitric oxide. And if it's done just, maybe in association with massage followed with cold water, that's usually more of an anti-inflammatory effect to remove some puffiness in the face. An exercise that's commonly done as well is to use a kind of massage oil, particularly around the neck and other lymphatic regions of the face. You want to just kind of follow the lymph nodes and massage down the face along the lymphatic tissue to get that flushing. So you have a night out, you're drinking a lot the next moment. You have a night out, you've been out drinking. The next morning you wake up, you haven't had enough sleep, and you've had this alcohol intake. Your gut bacteria is inflamed, your stomach lining's inflamed. You're in this inflammatory state from lack of sleep, from the deregulation of the sleep cycles. And the face will be puffier. So you're getting this water retention. The lymph isn't cleaning out the way it should. So stopping and just massaging that down can sort of shrink the face. So some of us get blotchy skin and fat-faced. I get fat-faced when I'm drinking. Doing this kind of massage can very visibly cause the face to shrink. And people will say, oh, wow, did you lose 10 pounds? No, I just flushed out all of the water retention in my fat face. I used to carry every herbal formula I could get my hands on. You can just imagine how this clogged up shelf space and mental space, plus it gave me a lot to dust every week. We looked at our most effective products, our automatic top sellers, and found that they coincided with the most popular and effective herbal products in East Asia. We decided to focus on the winners and then make them even better. Our research team in Chengdu upgraded these formulas using the highest quality herbs on the planet and rigorously testing them at pharmaceutical standard for quality and safety. You'll want to get your hands on this, and you'll get your supplies at botanicalbiohacking.com. Thanks for listening to the Botanical Biohacking Podcast. I'm your host, Andrew Miles.